and also other community resources. So without further ado, let's get on it, and I'd like to introduce you to Faith, Hope, and Love Communities groundbreaking initiative, the SALTview Food Access Management Software. But before we continue on, this is what you can expect this afternoon. I will provide insights about Faith, Hope, and Love mission, and also its history and goals. We will hear perspectives from different community leaders as far as their diverse background, shedding light on the importance of data gathering and reporting. We'll also engage in a question and answer session, and then we'll continue on making friends session. I call it making friends session, not networking, because our society needs to be embedded in relationship rather than transaction. So let me give you a brief history about Faith, Hope, and Love. Founded in 2005 with the inspiring tagline, "Mission Trip in Your Own Backyard." FHL has been at the forefront of training churches and organizations to identify local needs and resources. The organization's growth has been remarkable, evolving from distributing food at street corners, Washington streets, and rural street, to training organizations to initiate and sustain food pantries. So we grew after that. So we start recognizing that food insecurity is multifaceted. Because again, being food insecure is not just about the growling stomach. Being food insecure affects us physically, emotionally, and spiritually. So in 2007, FHL introduced innovative ways to gather and maintain data. So we utilized Excel, and we call that innovative back then, right? So our network of food pantries began providing regular reports, enabling us to analyze data and connect individuals with community resources to foster self-sufficiency. So understanding the demographics was crucial for better serving the food insecure population, and we all know that how can we serve a community if we don't know what's happening in the community? It's more than just being kind. I think being kind to people is very important, but kindness without accountability, I think, is short. And that's why we want to know that what we're doing really is making an impact, empowering people rather than enabling people. So the challenges arose with manual reporting that lead us to establishing missional food pantry program. So in 2010, the vision of a software solution took shape. Start thinking about it. One that would securely store, not only store, but also protect data, improve operations, and provide accurate information for effective decision making. And again, it's very, very important that we need to understand who we're working with and also who we're working for and who we are serving. So after years of dreaming and conceptualizing, FHL commenced the development of SALTview with the support of the City of Indianapolis and various donors. This software addresses critical needs, identifying what works and what needs improvement in the pantry operations, transforming record keeping and reducing errors, providing automated reports, which I call again the hidden treasure. Data in the technology world now, data is like gold. Somebody says that. So for me, I call that the hidden data that's just stored in the filing cabinets. And many of our small to medium-sized food pantries are suffering from funding because they were not provided the tools. They may be willing, but they're not provided the tools. And that's why we're very excited for this. Offering accurate data for city planning. All right, for those of you from the city, funding landscape, right? Funding landscape and a unified reporting. There are reportings that's happening now from the government point of view, from the funders' point of view, but they are fragmented. So we need some kind of framework between the food access, the health equity, and also other resources. So the launching of SALTview today marks a significant leap towards efficient, data-driven solution in our fight against food insecurity. So now we will hear perspectives from community leaders representing diverse backgrounds, shedding light on the importance of data gathering and reporting. So if you may come forward, please, Libby Lowry, and they will introduce themselves, and they will line up here. Ephraim Palmero, Kim Scott Miller, Jonathan Hetwold, Cindy Brungarter, Brian Swadley, Autumn Lowry, and Larry Smith. So again, we'll start with Lee, if you would, just introduce yourself, where you're from, and then also your perspective in about food insecurity and data.
Thank you, Merlin. It's wonderful to be here with you all today, and just watching this come together has been really exciting. My background is in human resources. I work for a local company called Engineering, and they're software developers. So I'm not a developer myself, so the technical how it gets done isn't really my area. But using data in HR in my career is so important. And I just, one of the things that really struck me about the SALTview software is just how important it is for consistency throughout all of the different moving parts from an operations perspective, first of all, internally, how that helps all of the people who actually run the pantry sites to, because no data is really that valuable unless it's high quality, because all our decisions in businesses are being made by the data that we gather. So if we're going to make decisions that really are going to have the right kind of impact, we need high quality data. And the way to do that is to have one application that is user friendly, it's consistent, and again, you're able to get that really high quality data. So that's something that I deal with every day in my business working, and it is a game changer. I really believe that the efficiencies that this is going to create in the entire issue of food insecurity, it's actually a game changer. So I just am thrilled to see this. I hope everyone understands the value. The reports that you can pull from the software is exciting. Again, I'm gonna kind of data dork as far as that goes. But it's so important, and I think that just it's gonna bring a lot of cohesiveness to the world that we're now living in, just as Merlin said about data, and how important it is. It is truly the goal that every organization needs. So thank you.
Hi everyone, my name is Ephraim Palmero, and I'm an assistant program officer at this Indianapolis. We are a community development financial institution here. I would say in regards to data collection, it's very important on our side of things, representing a mission-based financial institution as we continue to partner with organizations such as Big Love and our various community-based organizations when we look at reporting and when we also look at all the various things that they collect through the variety of their methods. It's important to look at the outcomes and the results that come from it. A software such as this allows us to partner with folks that have the on-the-ground knowledge and data that's available for them. That allows us to see how can we better support them, how can we better provide the technical assistance, and as we look to invest and support our disadvantaged communities, how can we create more equitable strategies to better support them? So those tools that FHL is using, such as this, becomes very more equitable and better in regards to their work in food access and food insecurity. So we're grateful for this new opportunity that they are presenting for us.
Hello, my name is Scott Miller, and I am the Food Pantry Director for the Father's Table Missional Food Pantry on the south side of Indianapolis. And I've actually been using SALTview since about October, November of last year. And I have to say that from someone who's actually collecting the data myself and putting it in the system, using the software, it has made such a big difference. It's really a game changer on my part because the ease of use and the ability to save so much time has really been very effective for me. I also need data and the record keeping for applying for grants, for private donors, and then also it automates reports that I have to submit. So that is, for me, very important because it is such a time saver. Also, we need the demographic information, like I said, to be able to apply for grants and other things. Also, one of the ease of uses is that my team can access that information from different places. So before, people would have to come into the office to be able to access that information, and now they can do it from anywhere. So it really has improved the way that we can share data and then use that to help our community.
Hello, my name is Jonathan Hegwall. I work for Penske Truck Leasing as the Assistant District Rental Manager, so I'm really excited to be here today and speak. Merlin's done a wonderful job in all of the open level, just educating myself and the associate base about some of the hunger scarcities and food insecurities within the Indianapolis area that myself really had no idea, and same thing with the associates. So being a part of a company that's been able to donate and have that philanthropy of part in the community is something that I really cherish close. We're coming up on a year and a half, 2 years of partnership, and I'm excited to continue that. So thank you everyone for the education on that. But when you kind of look at like the data gathering and everything, being in the trucking business, transportation is forever moving, so we utilize data for everything. In the peak summer, when we're looking at uptake of consumer moving, we have to understand where we should have our product line scheduled and where we should have the units for pickup at all times. So being able to talk with Merlin and hear about a software that's kind of coming to light of ungathering pockets in the Indianapolis demographic of those people who might be food insecure was really interesting to hear about, and anything that we can do to kind of back that and support it, I'm super interested in hearing it. So thank you again, everyone, for having us here today. Thank you, Merlin.
Good afternoon. My name is Cindy Brombarker. I'm the Interim Chief External Affairs Officer for HealthNet. For those of you unfamiliar with HealthNet, we are an FQHC in Central Indiana. We serve over 60,000 patients here in Indianapolis, most of whom live at or below the federal poverty level. They consistently talk to our providers about their concerns when they come to see them for care, and food scarcity is at the top of that list every time. What I find interesting is that these stories are different for every individual. And when you think about data and being able to use data to collect all these diverse stories to create patterns, information, where you can make great decisions, that is, as Merlin said, absolute gold. When it comes to health, empty bellies translates to unhealthy bodies. And we can't treat and advance the health of our community and our patients if we don't understand more about food scarcity, how it's being addressed, or where those marks are being missed. As has been shared with some of my colleagues, food scarcity and addressing that is about equity, it's about accessibility, it's about using that data to get the grant dollars that we need to answer this for the individual, for the family, for the community, and for the community that all of us call home. So we're very excited to see what is transparent here at FHL. Congratulations on this is exciting piece.
Good afternoon. My name is Autumn Lowry, and I'm the founder of From the Ground Up Foods. We are a minority-owned business, and we are servicing through urban farming in the Meadows community, along with Hopi Street Church of Christ. There's a critical need for food security in the Northeast Corridor, and we've worked for the past several years with organizations and businesses to support our food access needs. As a startup business, I've sustained our work by applying for grants to support farming education and food access initiatives. We contract with several organizations to sell and distribute our produce to food pantries and indirectly. The regular support the surrounding Meadows community by providing fresh produce and education workshops. Faith Open Love and Diabetes Impact Project recently approached us with an opportunity to provide custom healthy meal kits to be delivered through DoorDash to help out residents and those who may have specific healthcare challenges, including diabetes. As we've grown, we recognize the value of collecting relevant data to understand not only our clients' needs, but to also provide key performance indicators to support our fundraising efforts. As a farmer, data is not my strong point, and I need something simple, accurate, and efficient to be able to report back to grantors and to validate our work. We look forward to implementing SALTview software, not only in the farm, but also incorporating it into GEO Next Generation High School's agricultural program, which I'm currently teaching. I'm hopeful the SALTview software will allow us to maximize the value of our data and capture our information in one central location. Thank you, Faith Open Love, for the opportunity.
Hello, everybody. I'm Ryan Swatley. I'm the Chief Innovation Officer for DigiBridge. And first of all, I'd like to thank everyone for coming out today and for Merlin for setting this up. And DigiBridge is the company that actually developed this SALTview software. We co-created with Faith Open Love with really the emphasis on how we make it really for non-technical people to not be very difficult to have a learning curve. And when we partner with from a Faith Open Love perspective, we look at all the different stakeholders involved in this process, and that include food pantries and everything in the food access management chain. And ultimately, when we get data, we wanted to make sure that important is focus on privacy, because DigiBridge is a privacy-focused marketing company, and we wanted to ensure that everyone that we collect the data we needed for the, whether it be the food pantries or the donors, people in the, from a fund, from a city perspective, funding perspective, that we addressed three major areas that we would, the data would be personally identifiable, because we're concerned about personal identity to go. So we want to ensure that from a perspective of collecting that data, that it's all not only protected, but it's aggregate, and it's, so think of it more like a poll or a survey, so it's just the data the city needs and for the funders, but not anything that's personally identifiable. So we always emphasize the reports themselves, they're not actually about those people individually. And we're excited to see different stories, even from like Kim earlier, about seeing how easy it is and how it's doing its job that we first envisioned it to do. So today for me is a very exciting day for the launch of SALTview, to see it go from a dream to just a vision to be a real thing. But at the end of the day, the real reason we got involved in this, we learned about the needs of community, about how many people are really becoming food insecure, and how we can do something to make a difference. And also with food pantries, we learned a lot about how a software like this can help look at different areas of concern, whether it be how to better serve food as medicine, more healthy food, and also look at that, how that affects the whole ecosystem of food access management, how it's interconnected, how, which you mentioned earlier, if you have empty bellies, that can also lead to crime, addictions, and other things like that. So we're very excited to have a tool like this to bring with a software developed right here in Indiana, and not developed on the coast, that we can now take and address this issue of the food insecure and families that may be going through this. Thank you guys for your time and for coming today.
Good afternoon. My name is Larry Smith. I am President and CEO of Fathers and Families Center. Our mission is to equip fathers and empower families so that children thrive. We've served about 23,000 men over the last 30 years. We are a very proud partner of Faithful Good Love Missional Food Pantry. I won't belabor the point about acquiring data. That's important for both the men we serve as well as for the funders who are interested in working with us. But access to data is something that is incredibly important. So, for example, you can pull up SALTview and understand that 44 million households in this country experience food insecurity. It's about 1 in 8 of all households in our country. 69% of households in this country have to make a choice between food and utilities. 67% between food and transportation. 66% between food and medical care. Also, there is a racial and ethnic component. Roughly 22% of African Americans experience food insecurity. Roughly 21% of Latinx or Hispanic families do as well. The data and those numbers are important, but for us, the men we serve, this is more than just data. This is not theoretical. This is about affecting the lives of people every day. And so we see at Fathers and Families Center the effects that food insecurity has on the men we serve. And we're honored to work with Faithful Good Love and its partners to ensure that we can ameliorate this problem. The good news is that this problem is something that is entirely within our ability to solve. It is a matter of will. Thank you. Have a great day.
Wow. I wish I have memory like Larry, memorize all of this. But again, for most of us, we need software, right? For us to actually get those data. So let's give them a hand, please. Hopefully that gave you a different perspective. And I think, for us, again, that's what we would like to do, is to understand more as far as what's happening in our community. It's more than just giving away food. It's more than just the data. It's actually, we're talking about our fellow human beings. And we cannot actually work with them or serve them more effectively if we don't know who and what we're serving. So at this point, I would like to open the floor for questions. Our panelists.
This is being used within food pantries. Is there any used by those who are accessing those pantries? Are they filling out questionnaires or things like that, or is that just people who are working on pantries?
Let me just add this.
We'll just try a little
Yeah,
bit.
so that we can.
Sure. All right. My question was basically this is only being used, the system only being used by people within the food pantry, or is it being used by those who are accessing? So do they have to fill out questionnaires? Where's the information coming?
So the information comes from the recipients. We don't force them to do it, but it's not required, but also we ask them if they can fill out those vital information. Because if we have the demographics, say for example, as what Larry was talking about, in 46208, say from landscape funding, in 46208, you can actually identify out of 10 food pantries, there are 60% who are African American. There are 30% who are over 65 years old. And there are about 50 people who are under the age of 18 years old. So as a pantry, as a church, where most food pantries are in churches, smaller food pantries, they will be able to actually help those people who are, coming to the food pantry. So to answer your question, it's voluntary, and we enter the data. So Kim mentioned, enter the data of the individuals. The food pantry get the data, the names and the addresses and the phone numbers, so that they can follow up with them. But Faith, Hope, and Love, that's what Ryan mentioned, it's aggregated data. So we just get the aggregated data with no name or phone number, it's just the demographics. Does anyone have anything to add to that?
I could add just one thing to that, based on your specific question. To streamline the process, rather than having an individual, because they're wanting to get food and might be with their family, we have the person that is working in the food pantry, basically behind the screen, just asks us questions that have that personal connection with them. Not saying, hey, here's your form, fill that out on your phone. So we were much more about the food, kind of the people first perspective, and not about the process of you always say food is what you always say about food. It's not about food, it's about people. So we want to make the emphasis on the process, less about the technology, more about the relationship we can build. So that probably answers your question more. But he talked about it.
Yes, ma'am.
I think Kim spoke to the fact that she had learned some things already since the fall. And I was just curious, what things has she learned from the demographics? And I also wanted to ask if there are any medical questions that are asked, in your pooling of demographic information. And that was really, I work as a licensed agent financial advisor, and often I help educate people on their Medicare benefits, Medicaid, extra help, and helping them apply for those things. And I was curious because those types of questions, food is medicine, as you said earlier, and if that is coming out in the data, do you go that far in your demographic questionnaire and asking?
So we would gather information such as if they're receiving any other resources like Medicaid, Medicare, SNAP, food stamps, that type of thing. There's not any medical questions at this point.
And I was curious, for those that are developing the software, if at some point there would be a question like that, because that does help us in our planning and how we strategically put together our medical plans and the different benefits that we put in them, just at a high level. Are you suffering from diabetes or something like that? Or if there was a heart condition, mental health, in-stage renal disease, those types of things, just at a high level, not to, be so probative, but I remember in our conversation, we were just really talking about how can we best help them.
Yeah,
As we knew, just, at that level, again, treating the person.
That's possible. That's what we're working on right now. Again, within HIPAA, within the security of the people's information. But yeah, we get it. Especially we have someone, some people here from Diabetes Impact Program from IU, and so yeah, those are essential. But we want to make sure that we are within our guidelines of the government, and because we're not a healthcare organization, we just provide the demographics, and we will see how far we can go with that within limits.
Thank you.
Anyone else? Yes, ma'am.
Are you saying that if we could get that data of different medical issues that people have, that then, say, the in your pantry could then say, hey, we've got some information here that says we have diabetics, we have heart conditions, and we can sort of purchase the food that relates to better healthy food, right?
Yes. Yeah, that's why we have Barb Morris. She's going to be launching our consultant for food as medicine. So we're already looking into that, and yes, prevention is better than cure, and that's what we're looking. And again, with all the organizations that are presented here, I'm sure that we can find ways how we can help people more effectively and efficiently. Anyone from the panel who would like to share their views about that before? There's no more question. We're about to end the event. And anything else you would like to share?
I was just, to your comment, your question, that's exactly what our farm has been able to do with the Diabetes Impact project, DoorDash, and Pay One for Love. You know the demographics, I'm a community builder for the Northeast Corridor, also CBC. So I know the demographics of our community. We know that we have an aging population, we have a high rate of diabetes and heart disease. And so as I'm making my meal kits, I'm learning creative recipes that I can come up with that meat is hard to get. So can I make a meat-free meal? Doesn't necessarily have to be vegetarian, but it can. And making healthy choices to put in these kits for our clients.
Yes, and we worked with HealthNet in the past last year. They sent us special recipients, if you would, and we tailored the food that we delivered to them, just like what Anton is saying. So, you know, it's very exciting what's happening because, again, if we can really work together and really understand the deeper needs of people, whether it's unemployment, maybe being food insecure, could be maybe addicted to something, or maybe healthy living, and all of those are very important for us to have a holistic approach to alleviating food insecurity. So again, I would like to thank all of you for coming over. I'd like to thank the media who came over regarding this, and this is, I think, it's a groundbreaking thing that we're doing here. It's change of culture, change of thinking, change of living, and change how we look at how we can help one another. Because all of us have our own backgrounds. If we can understand what a person is hungry for, whether physically, emotionally, spiritually, we can come together and hopefully lift up one another, not enabling, but actually empowering one another. So again, I'd like to thank all the panelists here, and let's give them a big round of applause again. And that concludes our press conference. If you would, just mingle, make friends, and you'll find out more about what the others do. Really appreciate it.
I get worse. We should be in person.